Roughly 800,000 Americans suffer a stroke every year, and nearly a third of those strokes happen between midnight and 6 in the morning. Not during exercise, not during a stressful meeting, while the person is lying in bed unconscious with no idea their brain is losing blood flow. A 2024 AHA scientific statement on sleep and brain health confirmed that how you sleep, the position your body is in, the angle of your head, what you did in the hours before bed, all of these directly affect blood pressure regulation, blood flow to the brain, and the stability of clots that may already be forming inside your arteries. And yet, in all the conversations about stroke prevention, cholesterol, blood pressure, medications, exercise, almost nobody talks about what's happening during the 7 or 8 hours you spend horizontal every single night. Your cardiologist probably never asked you how you sleep. Your primary care doctor didn't mention it, but the research says it matters. And for some of you, it matters more than anything else you're doing during the day. Today I'm going to rank 5 sleeping habits from concerning to genuinely dangerous, counting down from number 5 to number 1. And when we're done, I'll show you the one sleeping setup that actually protects your brain and cardiovascular system while you rest. Number 5, sleeping completely flat on your back with no elevation. This feels like the textbook correct way to sleep. Spine aligned, no pressure on the shoulders. Chiropractors have recommended it for decades. But from a cardiovascular standpoint, especially for anyone over 55, lying completely flat creates a problem your body can't easily fix while unconscious. When your head and chest are at the same level as your feet, gravity distributes blood equally across your body. That sounds neutral, but it means more blood pools in the vessels of your head and neck than when you're upright. For most healthy people, that's harmless, but for anyone with high blood pressure, early-stage heart failure, or atherosclerosis in the carotid arteries, that increased pressure on the cerebral blood vessels during 8 hours of sleep is a sustained load that the body is already struggling to manage during the day. The small arteries in the brain, the ones that are most vulnerable to rupture during a hemorrhagic stroke, are under more pressure when you're flat than when you're even slightly elevated. Over years, that nightly pressure accumulation adds up. There's another problem most people don't know about. Your brain has a waste clearance system called the glymphatic system. It activates primarily during deep sleep and flushes out metabolic waste, including the amyloid proteins linked to Alzheimer's disease. Research published in the Journal of Neuroscience found that the glymphatic system works most efficiently when you sleep on your side, not flat on your back. Sleeping flat reduces the efficiency of this cleaning process, meaning your brain is soaking in its own waste products for longer each night. The fix is simple. Elevate the head of your bed by about 15 degrees using a foam wedge or by placing risers under the headboard legs. This keeps blood flow moving downward with gravity instead of pooling in the cerebral vessels, and it improves glymphatic drainage without requiring you to change your overall sleeping position. Number 4, sleeping on your right side with a history of heart problems. Right side sleeping is comfortable for most people, and for healthy individuals, it's perfectly fine. But if you have any history of heart failure, atrial fibrillation, or an enlarged heart, see, sleeping on the right side changes the dynamics inside your chest in ways that increase cardiovascular strain overnight. Your heart sits slightly left of center in your chest cavity. When you lie on your right side, gravity pulls the heart toward the right chest wall. In a healthy person, this shift is trivial. In someone with an enlarged or weakened heart, that gravitational pull changes the geometry of the chambers slightly, which can alter electrical conduction pathways and reduce the efficiency of each heartbeat. Several small imaging studies have shown that people with heart failure experience subtle changes in cardiac output when sleeping on the right side compared to the left. For anyone with atrial fibrillation, the position matters even more. Atrial fibrillation is one of the strongest independent risk factors for stroke. So because the irregular rhythm allows blood to stagnate in the left atrial appendage, forming clots that can travel to the brain. Anything that alters the heart's position or rhythm during sleep, including gravitational shifts from sleeping on the wrong side, adds to that risk. If you're managing AFib, especially if you're on blood thinners, sleeping on your left side is the safer default. Number 3, stacking multiple pillows under your head. This is one of the most common sleeping habits in people over 60, and it's almost always driven by one of two things: either acid reflux, which makes lying flat uncomfortable, or the subconscious sense that breathing feels easier with the head elevated. Both of those instincts are valid, but stacking 2, 3, or 4 pillows under your head solves one problem while creating another that's potentially worse. When you stack pillows, your head gets elevated, but your neck bends sharply forward at an unnatural angle. That bend compresses the vertebral arteries, the 2 blood vessels that run through the bones of your neck and supply blood to the back of your brain, the brainstem, and the cerebellum. A 2023 study published in the Journal of Clinical Neuroscience found that extreme neck flexion during sleep can reduce vertebral artery blood flow by enough to increase the risk of posterior circulation stroke, particularly in people who already have cervical spine degeneration or arthritis. Let me tell you about Margaret. Margaret was 72, lived alone, and had been sleeping on a mountain of 3 pillows for years because of chronic acid reflux. One morning, her neighbor found her confused and unable to walk straight. At the hospital, an MRI confirmed a small stroke in the cerebellum, the region of the brain supplied by the vertebral arteries. Her cardiologist told her the sleeping position almost certainly contributed. Not the reflux medication, not the diet, the pillows. If you need your head elevated, a single contoured pillow or a wedge that raises your entire upper body at a gentle incline is dramatically safer than stacking multiple flat pillows. The goal is to keep your neck in a neutral position while still getting the elevation that helps with reflux and breathing. Number 2, sleeping in a tightly curled fetal position. The fetal position feels instinctively safe. Knees tucked to the chest, chin down, arms wrapped around yourself. For younger people, it's usually harmless. But for anyone with cardiovascular risk factors, especially high blood pressure, atherosclerosis, or a history of blood clots, this position creates 2 separate problems that compound each other over the course of a night. First, curling tightly compresses your diaphragm. When the diaphragm can't move freely, your lungs take in less air with each breath. So less air means less oxygen in the blood. Less oxygen means the heart has to work harder to pump the same amount of oxygenated blood to the brain and organs. For someone whose cardiovascular system is already under strain, that extra cardiac workload during sleep is exactly the kind of subtle, sustained stress that makes overnight events more likely. Second, the tight curl compresses major blood vessels in the legs and abdomen, the femoral veins, and the inferior vena cava, which carry blood back to the heart from the lower body, can be partially kinked when the body is bent sharply at the hips and knees. Over 8 hours, that compression slows venous return. In people who are already prone to blood clots, whether from deep vein thrombosis risk, varicose veins, or reduced mobility, slowed venous return is precisely the condition that allows clots to form. And if one of those clots breaks free and reaches the lungs or the brain, the consequences are immediate. If you're naturally a side sleeper, that's fine. Just keep your legs slightly bent rather than pulled tightly to your chest, and place a pillow between your knees to keep your pelvis and spine aligned. The goal is to sleep loosely on your side, not coiled like a spring. Number 1, going to bed within 2 hours of a heavy meal or alcohol. This is the number 1 slot for a reason. It's not a physical position, but it's the single most dangerous pre-sleep habit for stroke risk. And almost nobody thinks of it as a cardiovascular issue. When you eat a large meal close to bedtime, your body redirects a significant portion of blood flow to the digestive system. That means less blood available for the brain and heart during the exact hours when your cardiovascular system is supposed to be recovering and resetting. Blood pressure normally dips by 10 to 20% during deep sleep, a process called nocturnal dipping. This dip is essential for vascular health. It gives your artery walls a break from the pressure they endure all day. Its research has consistently shown that people who don't experience this nocturnal dip, a pattern called non-dipping, have significantly higher rates of stroke, heart attack, and cardiovascular death. Eating a heavy meal before bed disrupts nocturnal dipping. The digestive process keeps metabolic activity elevated, insulin levels high, and the sympathetic nervous system active when it should be winding down. Your blood pressure stays elevated through the night instead of falling. If this happens once, it's trivial. If it happens several times a week for years, you are systematically denying your arteries the nightly recovery window that prevents long-term damage. Alcohol makes it worse. A glass of wine before bed feels relaxing, but alcohol is a vasodilator that initially drops blood pressure, so then causes a rebound spike as your body metabolizes it during the night. That rebound typically hits around 2 to 4 in the morning, which aligns exactly with the window when overnight strokes are most common. Alcohol also disrupts REM sleep, the phase when your brain does its deepest restorative work. Without adequate REM, the sympathetic nervous system stays activated longer, cortisol levels remain elevated, and the artery walls never get the full recovery window they need. On top of that, the 2026 AHA dietary guidance now recommends avoiding alcohol entirely for the prevention and management of high blood pressure. Reversing decades of moderate drinking is fine for your heart advice. This was one of the most significant shifts in the new guidelines, and it landed quietly. Most people still haven't heard it. And there's a compounding factor that ties eating and drinking together. When you combine a heavy dinner with even 1 or 2 drinks, the effect on blood pressure regulation overnight is multiplicative, not additive. The insulin spike from the food, the rebound hypertension from the alcohol, and the suppressed nocturnal dip all stack on top of each other. For someone with existing hypertension or carotid artery disease, this combination on a regular basis creates exactly the conditions under which an overnight clot or bleed becomes significantly more likely. The fix is straightforward. Stop eating at least 2 to 3 hours before bed. If you drink alcohol, make it early in the evening, not as a nightcap. And if you regularly wake up between 2 and 4 in the morning feeling hot, restless, or with a racing heart, that's your body telling you the rebound is happening. Pay attention to it. Now for the payoff. Based on everything the cardiovascular and neurological research points toward, the safest sleeping configuration for anyone over 55 has 4 components. Sleep on your left side. This keeps the heart in its natural anatomical position, optimizes cardiac output, and supports lymphatic drainage so your brain can clear metabolic waste efficiently during deep sleep. For people with atrial fibrillation or heart failure, left side sleeping reduces the gravitational pull that shifts the heart out of its optimal position and keeps the electrical conduction pathways stable. Elevate your upper body by 15 degrees. Use a wedge pillow or bed risers rather than stacked, flat pillows. This prevents blood from pooling in the cerebral vessels, reduces the severity of sleep apnea. Flexors, which is an independent risk factor for stroke, and helps with acid reflux without bending your neck into a dangerous angle. Use a single pillow that keeps your neck in a neutral position. Your ear should be roughly in line with your shoulder. No sharp forward bend, no compression of the vertebral arteries that supply the back of your brain. Keep your legs slightly bent with a pillow between your knees. This prevents compression of the femoral veins and keeps the pelvis aligned so the inferior vena cava isn't kinked, which protects against clot formation in the lower body overnight. Any single one of these changes can measurably improve how your cardiovascular system functions during sleep. Combined, they create a sleeping environment that actively protects your brain and heart instead of quietly working against them. So, conclusion. You spend roughly a third of your life asleep. That's not downtime. It's when your blood pressure is supposed to dip, your arteries are supposed to recover, and your brain is supposed to flush out the waste that accumulates during the day. If your sleeping position, your pillow setup, or your pre-bed habits are interfering with any of those processes, you're not resting. You're accumulating damage night after night in silence. You now know the 5 habits ranked from concerning to dangerous. You know what each one does to your blood vessels, your blood flow, and your brain. And you know exactly how to set up your sleep environment to work in your favor starting tonight. That knowledge puts you ahead of most people who will never hear any of this from their doctor. And the best part is that every single change on this list costs nothing and takes less than 5 minutes to put in place.